What determines how healthy you are? What you eat, how often you exercise, that's a big part of it, getting your annual checkups. But when we step back and look at health outcomes across our community or our society, we see health disparities that are not explained by these individual choices. For example, rates of the 5 leading causes of death in the United States are all higher in rural communities than in urban or suburban communities. Or babies born to mothers who have not completed high school are twice as likely to die before their first birthday compared to babies born to mothers with a college degree. Our life circumstances have a huge effect on our health. Health is Wealth is presented by Meridian Health Services with support from LifeStream Services. Health experts and economists refer to these life circumstances as social determinants of health.
So when we look at the social determinants of health, so those are the conditions, those in the environment where someone may be born, where they live, where they work, where they play, where they worship, that directly impacts their health, their well-being, and also their quality of life.
Another related phrase is health equity, which the CDC defines as, quote, the state in which everyone has a fair and just opportunity to attain their highest level of health. Dorica told me this idea of health equity really crystallized for her years ago when she was researching local poverty statistics to present to a group.
And I began to share my findings, and someone said, Dorica, the number is 1. And I thought, no, the number's not 1, right? I can't find any community that is dealing with 1% of poverty. And he said, no, the number is 1. And as it began to kind of sink in, what I realized was it was about the one person. If one person did not have access, if one person was struggling, then our community had work to do.
And the actual poverty statistics are obviously much higher than one person. 15% of Hoosiers live below the poverty line, and almost 13% are uninsured. If you live in poverty or are uninsured, or both, you're going to struggle to be able to pay for the medical care you need. For example, I mentioned earlier that the rates of the 5 leading causes of death in the U.S. are highest in rural communities. Why is that?
I think some of the challenges that Indiana faces, particularly our rural communities within Indiana, and getting access to healthcare would be twofold. The first is just having access to healthcare. If you live in a rural community, transportation could be an issue, knowing where to go could be an issue. But then secondly, being concerned about the cost when you do get to your healthcare provider is definitely a concern. And so those in our rural communities that may not have access to healthcare or access to insurance really struggle to make sure that they're gaining the care that they need for their long-term health plan.
But economic stability is only one of the social determinants of health. The Healthy People 2030 initiative groups social determinants of health into 5 main areas: economic stability, educational access and quality, healthcare access and quality, neighborhood and built environment, and social and community context. Dorica told me the top 3 barriers to health equity that she sees on a regular basis through her work with Open Door are housing, food, and stress. If
someone doesn't have access to food, chances are they're probably not going to follow the regimen that their doctor has given them. Be it medicine that needs to be purchased or even showing up for the appointment, because I at this time need to take care of what that tyranny of the moment is. I need to take care of the fact that I don't have food. I need to take care of the fact that I don't have housing. And those things coupled with everything else that I'm dealing with is creating a great deal of stress. So if I am stressed, then the likelihood of me really focusing on my health is slim to none, because that's only causing more stress. So it creates this huge divide between my health and my survival. And sometimes those two things won't feel like the same.
Health versus survival. I had never thought about it that way before talking to Dorica. And this is why the line between individual choices and life circumstances can often be a lot fuzzier than we'd like to think. I might see someone else's fast food heavy diet as unhealthy choices. Well, for them, it may feel like just surviving because they don't have a car and they have to walk a 2-mile round trip to the nearest grocery store.
I think to create a healthy habit, you have to first know what some of those healthy habits are, but you also have to be able to have access to those healthy habits. A lot of times we start with a eat more healthy, that will make you a healthier person. But if you don't have access to affordable, healthy food options, you don't have the opportunity to create that healthy habit.
Here in East Central Indiana, we've got a lot of work to do to get our overall health outcomes up to the state average, much less the national average. If we only focus on individuals' healthy choices, we're missing a huge part of the picture. But even focusing on healthcare in general leaves us missing a big part of the picture. In a sense, the biggest opportunities for improving our health outcomes are in things like food deserts, educational opportunities, transportation access, neighborhood violence. Making changes in areas like these can improve life circumstances in our communities, and in the process, improve health equity and health outcomes. Help others join this conversation by liking and sharing this video. And in the next episode of Health is Wealth, we'll talk about creating healthier habits for your whole neighborhood. So make sure to subscribe. Thanks for watching. I'll see you next time.